afternoon, everyone.
Hello.
Thank you for being here. Today we have an important topic that is part of our yearly conversations in higher education and in community colleges. We're going to be talking about mental health. And we are going to be having the opportunity to hear two panels assessing the current landscape and looking to the future. I want to start by first saying thanks to Young Invincibles, NAMI DuPage, NAMI Chicago, the COD counseling team, Cy Vera, Margaret Hernandez, and students Evan Gray, Connor Hernandez, Allison Ward, and Emily Sen. Thank you for your support and participation of today's event. So today's event is an important one as we begin our plans to be more intentional and holistic in supporting students who arrive at our campus with a need for mental health support. You will notice that student and faculty will be coming in and leaving class during the duration of the program. So not everybody gets to hear the full flavor of what's happening today, but we will be working very hard to distribute information about today's program. We want to make sure that we are here engaged and listening on this important topic, which is something that has been a concern for many, many years as we support students who are coming with a lot of issues on campus. Today we have the opportunity to hear two panel discussions on the critical need for action and support on mental health in colleges and universities, along with a discussion of trends and best practices from community organizations, counseling center, legislators, and College of DuPage students. We will also be sharing information on the Mental Health Early Action on Campus Bill, or HB 2152, and what its implementation would mean for young adults and campuses across the state. According to NAMI, nearly 1 in 5 U.S. adults live with a mental illness, and that's 46.6 million in 2017. And the American Foundation for Suicide Prevention reports that suicide was the 10th leading cause of death in the U.S. in 2017. The Illinois House Bill 2152 indicates that about 75% of all mental health conditions start by age 24, with higher rates of diagnosed disorders in college-age students. Our goal at COD is to develop a mix of supports that include our counseling team on campus, external resources that we already have in place and that we may be expanding, online tools, and promote text and online chats such as the National Suicide Prevention online chat support. By helping one person, we know that we may be helping the whole family. Mental health affects more than the individual that is in need of treatment and resources. Today, as part of our program, we are honored to have the presence of State Representative Dept Conroy, who is serving as our keynote speaker for today. Representative Conroy is a passionate community activist and a tireless advocate for mental health and DuPage County schools. We appreciate having her and welcome her to the College of DuPage and to our event, knowing that while she's in Springfield, she's pouring countless hours into her work as chair of the House Mental Health Committee. She was chief co-sponsor of the bill and continues fighting for our schools and voting to protect vital healthcare programs and finding bipartisan solutions to make our government more transparent and accountable. As chair of the House Mental Health Committee, she has worked hard to make sure insurers cover the care that patient needs. And she has partnered with local law enforcement to reduce drug use in our communities and has fought to ensure that hospitals and clinics across Illinois have better funding. We are honored to have her speak today. Please join me in welcoming Representative Conroy.
Thank you so much, and thank you for asking me to speak here today. As was mentioned, I chair the Mental Health Committee, and when you're in your third term in the House, you get to request a committee. You can request an existing committee or ask for a committee, and I requested a Mental Health Committee. What I was told was, you're crazy and there's no money, and I said, I know, and I know. So
that's why mental health.
Right, exactly. So, but I also understood at the time the incredible need and the crisis that our country, our communities, our states are in. And so I had a deep feeling that we needed to educate legislators so that they understood when we did get to that point when there was money, the need. So as all of us know, years ago we closed all these huge facilities that used to house folks with mental illness, most of which didn't have individual diagnosis. Nobody knew how to treat them. They just housed them. Well, in the meantime, we've done nothing to care for them. We have many people working very, very hard without resources in this arena. One of the things I want to tell you about my committee is that I have so much pride for being able to be the chair of this committee, because if you come into my committee, you cannot tell a Democrat from a Republican, because this is an issue that crosses every line. It doesn't matter who you are, how much money you make, what church you go to, who you love, how old you are. This affects everyone's lives. When I was first elected, I had a mental health committee in my district, and I was the only one in the state that had that, and this was about 7 years ago. And I live in Elmhurst, Villa Park area. I have raised 4 sons in Elmhurst who range in age from 22 up to 33. And within the first couple years I was in office, each and every one of them knew someone well that died from the heroin epidemic. Wow. And that was when I realized that mental health and addiction are really the same thing. They go together. And I saw that so many of these kids that were my boys' ages, many of them were in recovery, so many of them were growing up, all of our kids are growing up, not understanding their brain health, not understanding that we're all going to go through having anxiety, having depression. That's normal. It's like having a stomach ache, okay? You have a test, you become anxious. That's normal. You get overwhelmingly anxious, you can become depressed. Someone passes away in your life. That's a challenge, and we need to understand that, and we need to talk about that. We have to feel comfortable talking about the way we feel, because it's okay. One of the bills last year that I passed was to put mental health education into health education for K through 5. Seems like something that we shouldn't have to do, but we do need to do it. This year I have a bill that I intend to pass that will allow students to take mental health days as excused absences. And people have said to me, well, why do you need to do that? And the reason we need to do that is because we need to remove stigma. And it needs to be okay to say, you know what, Mom? I'm so overwhelmed today. I don't feel well. I don't know why I don't feel well, but I really need some time for me. That's how we take care of our brain health. And sometimes when we get older, and many times because we haven't been talking about this, we have so many, and I call them children because my children are this age, 18, 19 years old going away to college. They're so excited they're going to be independent, right? Well, they've had issues that they didn't really understand, but they just have ignored. And when they get away to school, they start experimenting because they have all this freedom. And all of a sudden, that anxiety, that depression goes away and they don't understand it. Why do I all of a sudden, I don't feel anxious. Now I'm the center of attention at the party. Everybody loves me and I'm having fun. But without that alcohol or without that marijuana, I don't do that. I'm the quiet one in the corner. They don't understand why that is. And all of a sudden they're self-medicating, and we know where that can lead. So this bill that was passed last year, HB 2152, is a huge step in the right direction. It does take funding, which we don't currently have a funding source for, but we are going to continue to work for, because this is ideally the way we need to treat our children, ourselves. We need to start talking about mental health from the day you bring that baby for their first well checkup. It should be part of the conversation, and it needs to continue to be part of the conversation. I sadly can tell you from a very personal experience I'm going through right now that stigma remains our biggest issue. It's still our biggest issue. Sadly, we're trying to put a facility. DuPage County has nowhere to send folks. Nowhere to send folks. We're trying to put a facility into a small community in DuPage County, and I have been told so many horrible things by people. And it's stigma. They don't understand. It's a lack of understanding. It's fear. If we were trying to put a heart hospital or a diabetes clinic or a dialysis unit, we wouldn't have these issues. So I continue to tell people everywhere I go, please talk about it. Please don't be ashamed of it. Don't let people have a conversation with you where they feel like they should be embarrassed about the way that they feel. We have to talk about this. This bill is what I hope and pray in 10 years will be fully implemented, so that when our students get to college and they're independent as they should be, and they're growing into those amazing adults that they're going to be one day and trying to figure out what they want to be when they grow up, they have the support they need. They can talk about it. They know as soon as they start to feel something, they know where to go. They know who to talk to. And it's okay. They don't have to try to sneak in or spend a lot of time figuring out, who do I talk to? Where do I go? I don't know who to talk to. I've had high school students say to me, no one has ever asked me how I feel. That's how we've gotten here. And we have a long road to repair this, but we can do it. And I have to tell you, your generation, the college generation, the high school generation, gives me so much hope. Because you guys have really become so engaged in conversation, in talking about things, in bringing things out. And I believe that that is a path that we all need to follow. We need to listen to you. Legislators need to listen to you. Educators need to listen to you. Because if we had started listening years ago, we would be so much farther along than we are now. So thank you so much for having me here today. Thank you for being part of a team that's trying to basically change the world. It's not easy, but we're going to do it, because without our brains, we don't function. So let's take care of our brain health. I also want to introduce to you the first panel, which will discuss the current state of youth mental health, both on campus and off. And at this time, I'd like to welcome our facilitator from Young Invincibles, Caitlin Bryady.
Thank you again, Representative Conroy. Thank you all for coming today. In our first panel, we will be exploring the current state of mental health on campus, so touching on barriers to care, peer supports, and resources both on and off campus. I'm going to take a minute to introduce each of our panelists. When I introduce you, please feel free to come take a seat on the stage. Silvia Donatelli is a clinical psychologist and earned her PhD from Purdue University. She has experience working in community colleges, university counseling centers, and community mental health agencies. Currently, she is a mental health counselor for the College of DuPage and provides personal counseling to COD students as well as teaches. Thanks, Silvia. Allie Moran is a clinical program supervisor at Metropolitan Family Services DuPage. She's a licensed clinical professional counselor with over 13 years experience in mental health fields in various roles in community mental health agencies and private practice. She has provided psychotherapy to children, adolescents, young adults, and adults in Illinois, Colorado, and California. Allie completed her master's in community counseling at Loyola University Chicago and her undergraduate studies in psychology with a minor in philosophy at the University of Illinois Urbana-Champaign. Sarah Troll is the population health coordinator at the DuPage County Health Department, where she provides backbone support for the collective impact initiative Impact DuPage. Her current work involves the areas of community health assessment, community improvement planning, and grant writing. And finally, Evan Gray is a current College of DuPage student and member of Psi Beta, the Community College National Honor Society in Psychology. So thank you all for agreeing to speak on our panel today. For our first question, I'm interested in exploring the trends, either regionally, statewide, or nationally when it comes to young adults and students' mental health. So what you all have been seeing in your experience. You want to start?
Yeah, sure. I'll take this question. So at Impact DuPage, we look at data specific to DuPage County and how we compare to the rest of the state and the country. And when we're looking nationally, some of these statistics were mentioned in the opening, that we're seeing an increase in psychological distress and suicidal ideation in young people, and that increase is happening more in young people than it is in the older age groups. We have some data that we can look at in DuPage County. ER and hospitalization rates for things like suicide and self-inflicted injury, as well as just in general mental health. In most of these areas, we tend to be similar to the rest of the state, but there are a couple, for example, adolescent suicide and intentional self-inflicted injury. We tend to have higher rates than about half the counties in Illinois. We also have data from the Illinois Youth Survey. So this is a survey that's done in our middle and high schools in DuPage County. And it asks students about a lot of different things. The primary focus is around substance use, but they do ask about any suicidal ideation and symptoms of depression. And similar to the rest of the state, 10th and 12th graders in DuPage reported, about 15% of them reported considering suicide. And then around 30% reported feeling so sad or hopeless in the past 2 weeks that they didn't do their usual activities. So that information is really valuable to highlight this issue and then to look at it over time as we're trying different strategies to address this.
I can speak a little bit regarding COD, what we've seen. We are a little limited with the type of data that we can gather, but what we do track is the number of booked appointments for students who seek personal counseling services. And from the 2016-2017 academic year, we saw about 500 booked appointments for students looking to receive counseling for personal reasons. And in the 2018-2019 year, we saw 1,400. Whoa. So that's quite the difference. And that number doesn't account for students who kind of come to us for what you might call a crisis situation or seeking services kind of more immediately. So we've definitely felt an increase in demand for services.
Allie, what have you seen?
Yeah, so something that we see also are high rates of depression, anxiety, and then second leading cause of death for young adults is suicide. And so obviously it is an epidemic, the mental health crisis that we are living and breathing in. Something that adds complexity to the issue is that there's a mental health counselor, social worker shortage. So that's another element to when we're trying to make sure we're getting services to people who need them. We're actually professionally needing more people to join the field. So I'll put a plug out there for students as well. Yeah.
Great. And following up on this theme of seeing an increase in young adults seeking help, what factors might explain this increase and this specific need in young adults?
I mean, something that I see a lot in the clinical work that I've done is with the increase of technology, tends to also increase feelings of isolation and loneliness. So there's this element when engaging in social media where we can think that we're actually connecting with folks, but it actually leads to feeling even more isolated. Something we also see a lot with social media are elements where people can't really escape a feeling of not measuring up. There's a lot of comparison that happens. I think that happens even more so now than it has before. So that I definitely see with social media, increased isolation, kind of a loss of community. We look at protective factors, not just things that decrease feelings of wellness. So looking at what helps to build, and some of those things are a sense of community and connection. So if you have erosion of that, of course it's going to impact people's levels of happiness and levels of depression and anxiety.
So Evan specifically, what trends or changes have you seen within your peers as students at COD?
I wouldn't say there was any more trends or changes through peers, but I have noticed that as a people, we need to change for reaching out to students who need this help. I've seen students that kind of sit off by themselves and they look kind of down, so I often walk up to them and I will ask if they are okay and how they're doing. Even if you don't know someone, it's always a smart idea to make sure that someone that they are okay and that they don't need like immediate assistance. Because I've been in that scenario where I would need immediate assistance and I did not have it.
Thanks. So focusing more on the student experience here at the College of DuPage, what paths do College of DuPage students have when they are seeking supports for mental health on campus?
Sure. I guess that one will be me. So we have the Counseling, Advising, and Transfer Center at COD. We have a lot of other campus offices that provide support to students, and students will go to and then refer to counseling. And faculty often will refer students to us. So usually if there is a caring faculty who's willing to kind of reach out to that student they see, they will send students our way or often walk them over. So usually they get to our office somehow, and then we, because we saw that increase in demand, we tried to take some steps to address that, and one of those steps was to create a screening process where we can accommodate more students more quickly. So students will meet with a counselor. We will do a quick screening to see if they're an appropriate fit for our services, and kind of the services that we offer can be a challenge in that, you know, we have other roles on campus, and we're not meant to be a clinical, community agency. And so we help students as it relates to their academic success. We help them, we're a support for them. We are often a holding environment. But part of what we do is work with students to connect them to agencies like the ones where my fellow panelists work, because we are limited and because there is that increase in demand. So we provide that screening, and then we will meet with students to either be a support to them, to help in that referral process, or to provide some brief intervention.
Great. Sarah or Allie, if one of you could speak to how that referral process might look on your end in receiving students.
Sure. So I work in Metropolitan Family Services, which has been around for over 150 years, actually. And I'm at the DuPage location, which is just a few miles down the road. So we have office-based counseling services available to people in the community. We take a number of different insurance providers, PPO plans, Medicaid, Medicare, and also do sliding scale based upon ability. And so we have a range of services, counseling services to help people and students. We have English clinicians as well as Spanish-speaking clinicians. And then in addition to Metropolitan Family Services, in addition to counseling, we also have legal aid services, which are completely free. And then we have a new line of services due to a merging with Family Shelter Services of DuPage, so that we have domestic violence services as well. 24-hour hotline that anybody can call.
Thanks. So given these resources that are available, what do y'all see as the most common barriers to students seeking help or then receiving that help?
I'll start. We have a few barriers that we see regularly, and I think one of them is financial barriers. I'm sure everyone can understand that. Students often don't have the finances to receive services, which is why organizations who offer sliding fee becomes important for us. Or students are hesitant for various reasons to involve their parents in their care, and so they might come from families who can afford it, but they're choosing not to utilize those resources to them. And then I would say another barrier along those lines is insurance. So students often don't have insurance, or they do have insurance, but there might be a $3,000 deductible for mental health services or psychiatric services, which is, for a student, that's it's impossible. And the other thing related to insurance is that students, they sometimes struggle, like we all do, with understanding insurance companies and how they work, and things like how their privacy is or isn't protected, especially if their insurance is with their parents. So there's a lot of questions about that. That's a knowledge base that we just don't teach people, and it varies a great deal and it changes a great deal. So I would say those are some of the barriers. And then on campus, we have barriers like stigma, which we work hard to go against. And then just the barrier of the limits of the type of center that we are. Just given that we're not a clinical setting, and so we are limited with what we can provide on campus. So that means students have to go off campus for those type of services, which provides other challenges.
Evan, from your perspective as a student, is there anything you want to emphasize or add on to that?
I want to add that specifically in high school standards, kids are really, really cruel. When I was first with a group of friends and I told them that I was getting therapy, they called me a crazy person and that I wasn't normal for having a therapist at such a young age. And I thought that was it was rather cruel, and I really never got over that, so I left that group of friends, and I surrounded myself with friends that understood that therapists are are helpful to you, and friends that were just more mentally helpful to me. And I would just say one of the biggest problems is just peers. Peers are cruel, and they won't understand.
Allie, in your work, what have you seen?
Yeah, well, I'm just so sorry, Evan, that happened, and unfortunately, I think that is common. There is still so much stigma. I can't tell you the number of people that I've worked with over the years, doctors, lawyers, college students, teachers, who opened up to me in session on how hard it is to make that first call. It takes so much courage to pick up the phone and reach out to a counselor or to go to your university setting to say, look, I need help. And the reality is that trauma is extremely prevalent in our world, right? It's, I think, about 60% of women experience a trauma in their life, and over 50% of men. And in addition to that, I know I'm biased, I'm a therapist, but I think everybody could use counseling at different points in their life because life is hard, right? Everybody goes through grief, through loss. And so, unfortunately, I think there is still so much stigma, and it takes so much courage to pick up that phone and make that call. And then, along with what you're saying, it's complicated. Insurance is complicated. Trying to figure that out is complicated. So we do everything we can to try and decrease those barriers, but it is really hard.
Sarah, in your work with community health improvement, have you seen any of these come up, or how have you addressed them?
Yeah, so we've looked at the data I mentioned earlier and identified mental health or behavioral health generally as a priority area that we're focusing on as a health department in partnership with lots of different community organizations for the next 3 years. So there's multiple pieces to that work. I did also want to mention kind of piggybacking off the concerns of the confusion created by insurance and lack of access to insurance, that the health department offers behavioral health services for those that don't have insurance, as well as has staff that can help people enroll in insurance. So help walk you through that process and what you might qualify for. And so there's a couple avenues of assistance in that aspect. We also have a crisis center, and I want to mention that availability. So our main office is located in Wheaton, and we have a 24/7 crisis center that has 12 respite beds. So if someone is maybe not at the level that they would need inpatient hospitalization, we provide services at the crisis center, but they also operate a 24/7 hotline. So anyone can call that number, and they're also an answering call center for the National Suicide Lifeline. So just wanting to make sure that those resources are known about.
Absolutely, thank you for sharing this. At this point, I kind of want to open the conversation up more generally if there are things people have thought about that they might want to add, something that came back to them about this issue. Great. If we've addressed everything, I would like to open it up to audience questions then. Yes, in the back.
Question for Evan. I can't really see your title is blocked. Are you a counselor or are you a student?
I didn't. Oh, hello. Evan, what I was asking, I'm sorry, I'm all the way in the back. I can't see your title. Are you a counselor or a student?
I am a student here at College of DuPage.
Okay. Are you part of a leadership team, like Student Government Association, or what led you to come to this panel? I guess that's my question.
In my Psi Beta club, the psychology club here at COD, we had Imano Dennis come in, and he talked about this panel, and I showed some interest in talking about it because I want to help people in my life, and that's just what I'm here to do.
Awesome. Thank you.
And we're so glad you could be here with us. Are there other questions that people have? Yeah.
I'm just curious, Sarah, do you work with the NAMI? Oh, sorry. Okay, I just was curious if you work with NAMI DuPage, because I know that they have a living room, and we think that's really helpful.
Yes, thanks so much for bringing that up. I would be remiss not to mention that NAMI DuPage is co-located at our community center, also in Wheaton, so that's where our crisis unit is, and then NAMI DuPage's office is located there as well, and they do operate the living room. Since that's their program, I'm less familiar with all the specifics of it, but I know essentially that they do an assessment for safety when someone comes into the living room, but then you're able to meet with a peer specialist that can talk through any kind of escalation of symptoms someone might be having when it maybe the ER isn't necessary, or you don't have that acuity of symptoms going on. So yes, the living room is also a resource at the community center. Thank you.
Thank you. Any other questions? Yeah.
Go ahead. I have a question. You've talked a lot about, thank you. You've talked a lot about people, students in particular, who are coming looking for services. What if you notice somebody who appears to you who needs help, who doesn't really think they do? How do you handle that? Experts.
That is a great question. Yes, yeah, really good question, and something that comes up a lot. So really, it's trying to talk with that loved one, and also counseling services can be accessed for somebody who is the family member impacted by someone else or friend who is experiencing mental health needs. But it's hard. Obviously, people need to want to get the services themselves. So I think, a counselor can hopefully help talk through what is getting in the way of that person wanting services. Oftentimes it can be addressed in a conversation, right? Like, what is the fear of seeking services? And then calling our intake line or talking with a counselor can help kind of troubleshoot those things.
And I'll add for anybody, but for students, if you're a faculty or a staff and you think that student might benefit from services, the first thing is to not be afraid to have that conversation with the student. It really just comes from a place of concern. But some of the common things that we notice that students tend to see as reasons not to seek counseling are some of those fears and some of the stigma. So anything you can do to help normalize counseling. Sometimes it's even helpful if you share an experience that you had with counseling, if you feel comfortable, or to kind of normalize that. It's not that something's wrong with you, but really a lot of people get counseling for a lot of different reasons. And so also reminding them that, the services we have on campus are free and confidential. Sometimes privacy is an issue for people, letting them know that, that it's confidential and that's not something they'd have to worry about. And sometimes people just have misconceptions about what counseling is and isn't. So reminding them that they are really the ones in control of the process, and the counselor is not going to force them to share beyond what they're comfortable. So just some common things that tend to keep people from coming. Yes.
I don't think I need them, maybe. I know that faculty and friends are often the first people that notice if something is wrong with a friend or a student. And what are the signs that faculty and friends should be looking for? And then what is the first step they should take if they are concerned about a friend? Different way of asking the previous question.
I mean, some signs would be changes in what is more typical of the person's interactions. If you see all of a sudden someone who has withdrawn from social contact in particular, of course, any talking about wanting to hurt themselves, any self-harming that might be happening, but really like that withdrawal from other things that they used to like to do or enjoy doing. So a lot of avoidance type of behaviors.
Faculty specifically, they can look at grades because grades will tend to drop when a student has some mental health issues. Specifically, when I was in Linden Oaks Hospital, teachers actually tend to put the grades in while you're still in the hospital, so that raises my anxiety a great deal. So I'm on Infinite Campus and I'm looking at all these F's and D's, and it's making my recovery process a lot harder. I wish teachers would, I don't think they're allowed to, but they would wait to put these grades in so I don't get all fed up about what my grades are in this class and if I'm gonna fail and have to redo high school all over again.
Another thing I'll add to is there can be differences with how people present either we call internalizing behaviors or externalizing behaviors. So keeping an eye out for that as well. Maybe it looks like for someone else, someone who's depressed, that they withdraw. Someone else might present as being more irritable, arguing more, getting into fights, things like that. So just kind of keeping in mind how it can look different for different people. So that's why I sort of honed in on noticing changes.
And what if the friend or student says, no, I'm fine, go away, and they're really concerned? What should they do?
That's a tough one. I would say it really depends on how concerned they are or what kind of behaviors or statements the person has made, to get to that point. Kind of fundamentally, it's the person's right to whether they want to receive counseling. We don't do mandated treatment here, and so it's really up to that student. We can't kind of pull them by the ear and make them go to counseling, although sometimes we wish we could. It's really their right. I guess the caveat would be if the level of concern was raised to the point where you didn't think that they would be safe or that someone else would be in danger, and then at that point you could take more serious steps in terms of calling the police or walking them into counseling. So it kind of depends on what they're presenting with.
Yes, one last question.
Yes, I totally want to piggyback from what you're saying, Miss. I'm a counselor at Prairie State College, and we are faced with that all the time. So I'm sorry, ma'am, in the blue, your question. So we do get presented with that from faculty quite often, where they know that students should come and see a counselor, but if the student says no, sometimes they are pretty much afraid because they know it's something serious. So what I tell my faculty members, I say, well, if you think this person is suicidal, it's up to you if you want to do a little bit more probing, to find out if they're having suicidal ideation, or you can ask the student if they wouldn't mind if I contact them. So if the student just outright says no, like they don't want anything more to do with the situation, like you said, we have to respect that. But sometimes when you do take that little extra step, if you're comfortable and ask them those questions, you will find out if they are indeed suicidal. And if they're suicidal, that trumps everything for us, like even if they tell you, like if you're the professor and they say they are suicidal,
Call 911.
yes, and you can get us. And also too, I want to piggyback off of the 911 police situation too. So I'm posing a question to the COD counselors. A lot of times, our Prairie State faculty members, they do get a little antsy, nervous to get our police involved. So they rather have us counselors, and by counselors, there's only like 2 of us at Prairie State. So sometimes I could be in a session, or like today I'm here and not at Prairie State. So if my colleague is not in her office, the protocol is we have a sign called the police. So they're like, no, that's too serious. We don't want to get the police involved. So I want to know, like, how do you all handle that? Like, what's your protocol for suicidal ideation? When do you get campus police involved?
That's probably a longer answer than I have time to give, but it's a good question, and a question that a lot of people on our campus ask as well. One thing, I will say the fear of the police is a common issue, and one thing that we're doing is we're trying to take steps to work with our police department. So inviting them to our meetings, to have workshops or trainings done that are police and counselors. So we have a lot of these ideas and steps that we're trying to take to try to make sure that when we do involve them, it's more seamless and we're on the same page with how we work with a student in distress. And I think we have work to do in terms of training our faculty or doing workshops with our faculty, kind of counseling and police together. So I'd say it's a good avenue for kind of next steps for us to take.
Yes, I love that.
And
That's a
that's
good
where the
idea.
crisis
Thank
center.
you.
Yeah.
The crisis center and living room.
Yes. Again, always. We need our community partnerships for sure.
Great. Well, thank you all for those great questions. That's all the time we have for that. So please join me in thanking our panelists for our first panel. And at this point, I'd like to introduce Connor Hernandez, a current College of DuPage student who serves on the Speakers Bureau for NAMI DuPage, here to share his story and explain the pledge cards that you have in front of you.
Hi everyone, my name is Connor Hernandez and I want to thank you for being here today. So as Caitlin had mentioned before, yes, I am a speaker for the NAMI DuPage Bureau, and I'm not going to give you my full story today as it would take quite a few minutes and we don't have that time. But for the last 24 years, I have struggled with several mental illnesses, many including bipolar disorder, ADHD, anxiety, depression, and a severe drug addiction. The illnesses had paralyzed me, defeated me, and left me without an ounce of hope for most of my life. Fast forward to my later years. After failing out of Hope College, I would attempt classes at COD for the next few years. These years were riddled with W's, I's, and F's. If you don't know what those letters mean, you're doing things right. I couldn't continue to do things on my own. I needed a support team that would help me get my life together. My mental health squad, as I like to call them, consisted of a therapist, a psychiatrist, a NAMI specialist who I would meet with, who I still continue to meet with regularly. We mentioned that before. It's a peer counselor. And the support of COD staff is essential to my growth. And I couldn't do it without my loved ones. And my mom is actually here right now. Hi, Mom. Now, after a year of working on my mental health in a Christian rehabilitation center, I now speak for NAMI DuPage, traveling different hospitals, telling my story, bringing hope and educating people on mental illness and addiction wherever I go. Now, after 5 attempts at English 1101, just last week, I can proudly say that I completed the class with perfect attendance, no missing assignments, and my first college A. I can also proudly say that I've been sober for over a year and a half. There is so much that needs to be done in order to create a world where everyone is able to access the care that they need. While many of these changes must start at the top, there are some things that we as individuals can do to take care of our friends, family, coworkers, and community. That is why it is time to commit to action, such as those laid out on the pledge card. You can, A, spread the word, join a conversation via social media using #MentalHealthMatters, and help eliminate the stigma. Seek support. If you or someone or a loved one needs support, it's out there. Beyond support on campus, there are crisis hotlines that you can call, a crisis text line which you can access by texting the word REACH to 714-714. Please know that you are not alone. Build your skills. Attend a mental health first aid training offered by NAMI DuPage. Educate yourselves. Become a policy expert and join email lists, sharing your email on the pledge card to keep up to date to the latest on the discussions to local, state, and federal level. Become an advocate. Join meetings. Take action. Become an organizational champion. Provide resources to staff and those who you serve, which might include training staff on how to provide culturally competent services, provide information on resources in the community, and host mental health awareness. I hope you all take a second to fill out your pledge cards. I'd now like to introduce Amber Kirchhoff, the Manager of Public Policy at Thresholds, who will be facilitating our second panel. Ms. Kirchhoff has a decade of experience in public policy, including roles in state government and research institutes and nonprofit organizations. Currently, she is the Manager of Public Policy at Thresholds, a nationally recognized community health treatment provider. In her role, she helps lead the agency's advocacy agenda by handling outreach to public officials, developing partnerships with external stakeholders, and acting as an in-house subject matter expert. She helped launch the statewide Healthy Minds, Healthy Lives Coalition and played a central role in the passage of the Children's Mental Health Crisis Act, as well as securing key provisions in the 2019 Medicaid Omnibus Bill. Please join me in welcoming her.
Hello, everybody. I wanted to start by saying thanks to Connor for that introduction, and thank you also for sharing your experience. It's not easy to get up and share things that are that personal, especially in light of some of the things that we talked about earlier, which is the prevalence of stigma and how much that gets in the way of people seeking services. So thank you, Connor, and thank you all for coming today and being here for this important conversation. This is my first time at the College of DuPage, and I gotta say, I'm impressed. I didn't know what to expect today, but it's huge. And while it's nice and quiet in here, out there it's so alive and vibrant. So I'm really excited to be here because this is such an important conversation. And as was said before, my name is Amber Kirchhoff. I am the Public Policy Manager at Thresholds, and we are one of Illinois' largest and longest serving community-based mental health organizations. And we serve about 6,000 folks across the greater Chicagoland area, including just next door in Westmont. So we're over on Oakmont Lane if you want to swing by and see us sometime. And there's more information out there too. But as Connor mentioned, my role at Thresholds is really to build partnerships with community groups, with elected officials like Representative Conroy, who kicked us off today, and advocates like all of you. I consider you all advocates for being here and being a part of this conversation, and I hope after today's conversation you'll consider yourself an advocate as well. And what I try to do through those partnerships is work with folks like who are going to be on our panel here in just a second to pass better laws and to get more funding so that we can expand access to critical mental health services. Because for far too long, there have been so many cultural barriers, like the stigma that Representative Conroy and others have referenced on stage today. But also there are real structural barriers in our way, and some of those have to do with policies around how services are funded or how, what your insurance covers. But all of those are really just getting in the way of people getting the supports and services that we all need to live well, to grow and to thrive. So with that, I'm going to go ahead and welcome up our panel. So as I read your biographies, if you'll join me up here on stage. So first we have Jen McGowan-Tomke. She's the Associate Director of NAMI Chicago, the National Alliance for Mental Illness. She works primarily on NAMI Chicago's policy and advocacy agenda, improving the mental health system in Illinois, including focusing on prevention and early intervention, strengthening mental health services, and enhancing support services, and supporting a comprehensive crisis response system. Jim was the co-chair of the statewide mental health opportunities for Youth Diversion Task Force, which I had the honor of serving with her on. And she previously worked at the University of Illinois at Chicago School of Public Health and as a healthcare policy analyst in Illinois, the Illinois Governor's Office, where I first met Jen. Our second panelist today is Candace King. Candace is a founding director of DuPage Federation of Human Services Reform. Got it? Yep. Okay. Like Evan said, we need to lend a helping hand if we see someone we think might be in need. So let's put our words into practice here. Sorry, I'll start over with your introduction, Candace. Candace King is the founding director of the DuPage Federation of Human Services Reform. She served for 23 years until her retirement in January of this year. Congratulations. She's the primary author of many community profiles that have activated new services in and around DuPage, including Access DuPage and Language Access Resource Center. She's also the primary author of the 2016 Behavioral Health Community Profile. Welcome, Candace. Next, we'll have joining us David Albert, who is the Deputy Director of Clinical Operations for the Illinois Department of Human Services Division of Mental Health. He's a licensed clinical psychologist, and prior to his current role at DMH, Dr. Albert spent 12 years leading university mental health services, most recently at the University of Chicago. He has also served as director of the Child and Adolescent Ambulatory Psychiatry at the University of Connecticut Health Center and as a consulting psychologist at the Connecticut Department of Children and Family Services. Thank you, David. Sounds like you have a lot of great experience for us to learn from. And last, but certainly not least, we have Dr. Nathania Montes, who is the Interim Dean of Students and Associate Dean of Counseling and Advising and Transfer Services at the College of DuPage. She has over 20 years of experience working in higher education. She has worked with students at the former Barrett College, Northwestern University, University of Southern California, and here at COD. Trained as a psychologist, Dr. Montes spent the early part of her career focusing on the academic and social well-being of students in her role as a full-time counseling faculty member specializing in mental health. As the Associate Dean of Counseling, Advising, and Transfer Services, she oversees the counseling faculty as the department strives to provide exemplary educational training, career, and personal counseling to ensure that all students are aware of and have access to support services that can help them succeed. And we will also have joining us Allison Ward, who's a current student here at COD and who brings her experience seeking support on campus. So if you join me in giving a hand to our panel. And as I mentioned, I'm really excited to be able to be with you for this conversation because my role really does focus on those policy and systemic barriers that get in the way of people getting the services that they need. And that's why I'm really happy that we're going to have the opportunity to talk about the Mental Health Early Action on Campus Act, which I was able to work with Jen from NAMI Chicago and her team, as well as Young Invincibles, in crafting this year and successfully guiding through the Illinois legislature. So just to sort of give us a foundation of understanding, I'm going to actually turn it over to Jen, who's going to tell us a little bit more about the Act and what provisions it lays out so that we know what will be changing in the near future.
Thank you, Amber. I'm so happy to share a little bit about the Mental Health Early Action on Campus Act, which was a really important effort of NAMI Chicago and many people in this room, and we were so grateful for the support of those of you in this room that helped us push this legislation forward. So as a quick background, in 2017, the National Council on Disability put out a report around mental health access on college campuses. And it did a great job of sort of sharing the national picture of a lot of the things that we talked about in the first panel, and also reviewing the current state of mental health services on college campuses. And at NAMI Chicago, we sort of took that information and said, how could we use this as a foundation for support services and clinical services on campuses around the state of Illinois? So a lot of the provisions within this legislation kind of come from that research and come from the research that we know exists in Illinois around access to services. And one thing that I should say is that we know that many campuses are doing great work individually with students, doing the best that they can with the resources that they have. And the perspective of this legislation was really to offer additional resources to support this population of individuals at a time in their life when we know that depression and anxiety emerges. So the provisions within this legislation are pretty comprehensive. They start with awareness. What can we do during orientation? What can we do when we first interact with students on campus? Moving to training, what can we do for the adults on campus that have great questions, like we heard already this morning, about how to support students who may be experiencing crisis or maybe just need a little more support. So what does training resident assistants on campuses where students live on campus? What does training campus security look like? What does training campus advisors look like? Those are provisions within the legislation. We then move to sort of a piece that we've heard a little bit about here from some of the students already around peer support. So we know that the right peer support is really critical, and Evan kind of talked about that a little bit, but we know that having the right support of someone who has experienced what an individual is going through can be really, really helpful. So the legislation lays out provisions both for who the right student candidates might be for peer support programs, and also puts this as a foundation of how we can get students into a safe space to talk about what's going on in their lives. There is a provision within the legislation around clinical capacity, so looking at the capacity on campus, capacity with partners, which COD is doing a great job with, and also what does telepsychiatry or app-based support look like for students as an emerging trend. And then we also have a provision for technical assistance, because some of the things that I heard in the first panel this morning were around policies, right? What do teachers have, what do faculty have the flexibility in doing when it comes to putting in grades, for example? The policies around those individual pieces that happen on a college campus, all the way to what does medical leave look like for someone who's having a mental health leave. Those are really important things that college campuses need to consider, and so our Technical Assistance Center within the Illinois Board of Higher Ed would sort of facilitate some of the support for those pieces. What does building these programs on campuses across Illinois look like, and what technical support is needed, along with other experts at DHS and other state agencies. So I hope that was quick enough, but that is an overview.
Yes, excellent. Thank you. That's a lot of information for folks to digest. But as you can see, we were able to put a lot of significant things into this piece of legislation, and we're really hoping that this will help folks to be able to get connected to what they need, both on campus and in the community. And we're going to have a chance to explore some of those aspects a little bit more sort of through our conversation today. But one of the pieces that you mentioned as part of the legislation, Jen, was around peer support. So folks with lived experience being able to help to counsel and speak with people who are coming to seek assistance on campus. And I just think that that's such a valuable resource, and I would love to hear more from Allison and from Dr. Montez about sort of your thoughts on peer supports and what that can look like on campus, and the benefit that you see in that.
Here at COD we do have a student club. we do have a student club, our mental health advocacy team, and what we found through that club is that students really are looking for support from people who are going through the same issues that they're going to, and who also are kind of living through the same kind of daily life cycle of being a student. And the vulnerability, I think, as well, that occurs in being a student as well. Because I do think being a student, there are two things that can also exacerbate a lot of mental health conditions, which is a lack of sleep and a lot of stress. And so, again, being able to have that peer support becomes extremely important. And that when peers are educated with the resources as well, a lot of times they will go to their peers before they will come to anyone else as well.
Yeah, I definitely agree with that. I know that for me, I'm definitely still learning about my mental health and what is a symptom of anxiety and what's just like something else that isn't related to that. And definitely talking with peers, it's really helpful because they're your age, and it is very validating to hear oh, you're dealing with that mentally? Oh, I am too. It creates a sort of bonding and a sort of validation that you're not the only one going through this. And so I definitely think that peer support is very helpful for that reason.
Absolutely, and just to sort of build on what you said, I think we heard that from some of the other student panelists who are with us today, speaking about, it's difficult to come forward and to share something. You feel kind of vulnerable sharing something really personal, especially when it's not always well received. And so I appreciate you sharing your perspective about how meaningful it can be to connect with somebody else who understands what you're going through and can be there as a line of support for you while you're trying to figure out, everything and how best to get plugged into whatever supports that you need, so thank you. And that makes me think too, I have a lot of questions here, but I'm getting all kinds of things coming up for me as we're starting to unpack this a little bit more. And I think peer support can be really valuable from another perspective too, which is that we need to be able to reach students in a way that's meaningful for them. And so that looks different for everybody, right? So maybe some of our panelists could talk a little bit about the importance of cultural and linguistic competency so that we can make sure that our services are not only available to, but really accessible to students from all different backgrounds in our communities.
I can probably take that one.
Sure. And feel free for more than one of you to jump in.
Okay, great,
Yeah.
thank you. The DuPage Federation runs a program called the Language Access Resource Center. My friend Lourdes Lonergan used to work with me in that program. And we looked at what was keeping people in our area from accessing the services that they needed. And linguistic and cultural competency was very high on that list. So just an important thing to know is we provide high quality interpretation and translation services. We train interpreters. I would encourage folks who are fluent in English and another language to consider getting trained as an interpreter. And we also help organizations plan for linguistic and cultural competency. Because if you don't think ahead of 26% of the people in DuPage County don't speak English at home, and about 10% don't speak English at all. And so if you don't plan for it, it's going to come along and get in the way of achieving the mission of your organization. Then the other thing that it has always been a barrier, not just linguistic and cultural competency, is access to healthcare coverage. And so we developed a training called Making the Connection that is intended for healthcare and human service professionals who need to know, who are scared by, how do I access health insurance and what coverage am I eligible for? And so the Federation's website has information about that training. And I would encourage, and it's a one-day training, or sometimes they do special ones that are shorter. And so for professionals, I would say, get comfortable with the insurance landscape and know what you're likely to be eligible for. And for students, the good news is, due to the hard work of public officials, advocates, legislators, at the state, local, and national levels, the resources for health insurance are not perfect, but they exist. And so there is some way for everybody in our community to get health care coverage. And that's an important takeaway message. But, you know the old saying, you can lead a horse to water, but you can't make him drink. Every young adult needs to understand how can they get coverage. And now that we've got the open season coming up, it's an important time to think about that and take steps to make sure you get covered.
Thank you, Candace, for mentioning that. I wanted to let folks know, too, that under the Affordable Care Act, which is still in effect, although there may be confusion around that given all of the news that we've had over the past couple of years, that young people can stay on their parents' insurance for up to age 26. So I think in terms of what Candace was saying about ways to potentially have your services covered, certainly there are many resources that are provided for free here on campus and even in the community. But if you are looking to sort of leverage what medical coverage you may have through your parents' insurance for students, just know that you are eligible to use your parents' insurance up to age 26. And it looked like, Jen, you may have had something that you wanted to add after that.
I just, I wanted to add about the sort of entry point for students, and others may want to comment on this as well, but I think there were some questions about, you know, what from a faculty perspective or an adult perspective, what do we do to sort of get students to come into treatment or into services? And I just want to share that sometimes we're not the best messengers for that, right? Sometimes our students or peer supporters are the better messengers for that. So I think I would just encourage folks to think from that perspective as well. Not to dismiss something that you're seeing, but to connect with the right folks to make sure that that introduction is the best and most supportive and trauma-informed, you know, introduction to have for that student. And one of the most important reasons for that is when individuals encounter the mental health system and have a bad experience in their first experience, they're very unlikely to come back. So that's, I think, one of the important reasons to think about that introduction.
I would just add one thing, which is that, you know, for many students who are struggling, a traditional mental health intervention may not necessarily be the most appropriate intervention. There's really good research that shows that peer support done right, combined sometimes with some technology-assisted intervention, some app-based programming, can be really effective for students who have low levels of depression, low levels of anxiety. And I think what's, you know, one of the challenges that we face really nationally, it's actually internationally, when it comes to meeting the growing demand for mental health services on campuses, is the fact that, you know, that demand is just overwhelming. And the sort of one-size-fits-all approach to providing services is just not realistic, and it's actually not optimal. So peer support, and I want to emphasize when it's done well, because it really does need to be done well, is a really important piece of the safety net that we want to be able to provide students.
And I would just like to add too, given, I know especially for us at College of DuPage, the diversity of our student body helps from an inclusion perspective as well, and looking at the intentionality when we're reaching out to students and what makes them feel safe and who can make them feel safe. I've pushed my counselors probably a little bit more than they'd like, but to get out of their offices more so that students can be more familiar with who the counselors are, so that when they are either referred to a counselor or if they see a counselor, sometimes it is those impromptu, do you have a minute conversations that yield a lot more than the formal sit-down conversations as well.
Yeah, that makes total sense, because as we talked about earlier too, sometimes just making the appointment or picking up the phone can be a barrier in and of itself. So like you said, if they're sort of familiar with that person and can catch them in their natural environment, that might be a little bit easier way to approach. So that's great. And Dr. Albert, you mentioned a little bit about how you see a benefit in peer support as being an effective way for young people to connect with services in particular. And that is obviously one important provision within the legislation. DHS is a really important partner. You were supportive of the legislation and obviously will be critical for the implementation as well. So could you tell us a little bit more about why this initiative was so important to the department and sort of what you hope will change in the landscape of students and young people being able to connect with services as a result of the legislation?
I'd be happy to. I mean, full disclosure, when this legislation was being written, I was still in the world of college mental health in my previous role at University of Chicago. So I heard about it when I was in that role, and when I took on my current role with DHS, Division of Mental Health, this summer, one of the first things that came across my desk was this legislation, and I was really excited to see that it was moving forward, and selfishly I was excited to be invited to be here today because I wanted to learn more about it and meet the folks who were involved in crafting legislation. You know, I think so I work for the Division of Mental Health, whose really mission is to do everything in our power to ensure that citizens of Illinois who require access to mental health services, you know, have that access. So, you know, access to care, access to quality care, lowering barriers, which is a theme that's been running through the conversation today and is huge, is something that, you know, we're really, that's what we're here for, right? So, to my way of thinking, there was not, you know, why wouldn't we be supportive of this legislation, which I just think has the potential to make a real difference in the lives of, you know, many young people. The numbers are really astounding, and having been in the trenches for years, I would say, you know, it can be overwhelming, attempting to sort of meet this need. And by the way, I'll say, we've been talking about stigma. I think we're in the world of college and university mental health, we're sort of always working at cross purposes with ourselves because we're doing everything we can to chip away at stigma and lower barriers and make it easier for young people to identify when they might potentially benefit from something that a counseling service, for example, has to offer. And we're like, I say we still because I still think of myself as being working in that world.
That's good.
Yeah, you know, we are, everybody who works in college mental health knows how hard it is to meet that demand. So you're simultaneously trying to make sure that everybody who needs help is seeking out help, and then you're trying to figure out, okay, how are we going to help these people now, right? And so I just think that this legislation, particularly if, you know, I'm really hoping everything gets appropriated and it's fully implemented, I think has the potential to really move the needle. So we're very supportive.
Absolutely, and that is certainly the hope. In addition to peer support, another key component of the bill, and one that I say sometimes is not the sexiest, but one piece that I was most excited about in this legislation is the Technical Assistance Center, and then the role of building of community-based organizations and building relationships with the campuses so that we can make sure that those organizations are an extension of support for the students when they leave campus, because we all know that we are individuals, but we live within a community and a family, and so it's important that we sort of think holistically about where all our options are for getting support, and some of our needs may not be able to be met on campus, so knowing what's available in the community is important as well. So sort of to that end, that was a long lead up, but Candace, I was hoping maybe you could say a little bit more to us about the role for community-based organizations and how you see those partnerships and sort of what the framework of the legislation will do to support that.
I was thrilled to read the legislation and to commend the people that were involved in developing it, passing it, and now implementing it. And one of the pieces of learning that I've learned over my career is that when people who are involved in serving a particular population or particular issue know each other, then, so you start with relationships, and then you can start identifying opportunities, and possibilities start to emerge, and then action becomes inevitable. And so I think starting with the kind of thing that's happening here today, where people who care about this issue can get to meet each other and understand that there are things they can do together to move the needle. I want to give you a couple of local resources that I'm particularly excited about. We have an organization here in DuPage County called the DuPage Health Coalition, which the Federation was involved in starting, and we still sit on their board. And they provide a program called Access DuPage, which provides access to health care for people who are not eligible for anything else. And many of the people now that are in that program are not in this country legally, but they can still get health care. Then there's the Affordable Care Act programs. There is insurance, as Amber mentioned, through family health insurance. Everybody can get access to health insurance. Then we then moved to working with community agencies to use that health insurance to help expand services and expand availability to services. So now the health department has benefits navigator, they call them navigators, which I think is a wonderful term, to help people figure out what am I eligible for, what paperwork do I need to do, and make sure you get it. Because even if you think if you're a young invincible and you think you're not ever going to need health insurance, you are one slip of the hand or accident away from needing health care. And if you have a payment method, you have choices, you have opportunities. So I think that's something I can't emphasize enough. One resource that we have here in DuPage County that is so exciting is the Dispensary of Hope. Again, this was started by our partner, the Health Coalition. It's a pharmacy that provides free medications to people with incomes under twice the federal poverty level. All you have to do is get a valid prescription and a self-attest to what your income is, and then you can get there's a formulary, so they don't have every drug, but you can get up to 90 days supply for free. So that's a huge asset. And so what we have now is, I call it the patchwork quilt. We have a complete health safety net for low-income people. Now, is it perfect? No, not at all. But it's really, we've come a whole long way that I can sit here and confidently say there's a way to get health care. And as Representative Conroy emphasized, brain health is health. Did that answer your question?
Yeah, absolutely. And well, you touched on so many important things. I feel like we need to talk offline because so much of my work in my day job too is around Medicaid and what services are provided there, and trying to preserve the Affordable Care Act, because it really has been a line into mental health services for so many. Because in addition to this piece about allowing for coverage up to age 26, many people may not realize, but part of the Affordable Care Act was a package of what they call essential health benefits. And basically that means that private insurance has to cover 10 key kind of core health services. One of them was mental health and substance use treatment. So that was really a game changer in our country on the landscape of healthcare, ensuring that everybody would have access to some basic mental health and substance use treatment services through their insurance. So I thank you for bringing that up. And there are many, many services that are also paid for under Medicaid. So for folks who are covered through public insurance, just know that there are many providers in your community who do accept that insurance as well. And that sometimes, depending on what your needs are, though it comes as a surprise to many, Medicaid is oftentimes an insurer that covers an even more robust set of services in the way of mental health and substance use, which I think most people don't realize, but Medicaid is actually the largest single payer of mental health services in our country. So I think that's important to recognize too. But that helps us, I think, to flesh out a little bit more about some of these key pieces of the legislation. I don't know if others on the panel, maybe Dr. Montez has more to say about that relationship and partnership that can happen between community-based organizations and providers and other NAMIs and other support groups, or even other types of partners. I mean, I've been focused sort of on human service and healthcare providers. Probably I'm a little biased because I work for one. But there are many other groups in the community that may be partners too, like I said, that can be sort of an extension of that support network for students. So I don't know if you have other thoughts on who some of those other community partners might be.
I think for us here at COD, because we are so large, we are constantly looking for different agencies that we can refer students. And one of the things that we've struggled with, which is why something like this becomes so important, and I hope that we continue to do it and continue to build the partnerships, is that we can refer students in a more personalized manner. I think some of what we've struggled with is looking at a list of resources and saying, okay, well, who should we send that particular student to? But to be able to say, we're going to refer this student to this agency, to this person, and I think sometimes that helps with the handoff, because a lot of times if we've already, it's a hard step for them to come in the first time, and if we're going to be doing the referral, it helps to have the relationship and then be able to do the follow through as well.
Can I just share one thought? I'm just reflecting a bit on the conversation and thinking about the fact that 10, 15 years ago, we really wouldn't be having this conversation. The landscape has shifted so dramatically when it comes to college student mental health. It's really quite remarkable. And college mental health used to be considered sort of a problem for college counseling services to handle, right? And it was all about, the conversation was about as complicated as there's a counseling center on campus, and if you're having a problem, make an appointment, right? And now, I think for a whole variety of factors, variety of reasons, we recognize that it does take a quilt. I mean, it's sort of, it requires addressing the needs of students requires a real shift in the conversation to one that includes faculty and staff. Sometimes faculty can be the hardest, actually, to engage in this conversation. In my experience, I can't speak to the College of DuPage, but I think it's critically important to help faculty understand the sort of unique position they're often in to notice when a student might need help, and to actually have the student's ear when if they notice something they're concerned about. And partnerships with, there's too much work to be done by any one counseling service. Really, honestly, no matter how big the service. I can tell you, no matter how robustly staffed that service is, it can't do it on its own. And so partnerships with community agencies, nonprofits, I wanted to also mention, AA, NA can be really important. We need to be thinking about all of the resources that are available, and then how do we work together to really purposefully meet these needs. And that's one of the reasons why I think this legislation has so much promise, because it sort of bakes into the, I'm going to mix metaphors, it sort of requires our state universities and colleges to be thoughtful and to create a space to kind of think through how they're going to meet these needs. So.
Yeah, and hopefully that Technical Assistance Center will be helpful in guiding administrators about how to go about developing those relationships and amplifying best practices that we are seeing, because we know that many campuses in Illinois and across the nation are doing a really great job, even with many limitations and constraints on their resources. And so to the extent that they can learn from one another and help to sort of translate lessons learned and that sort of thing, I think there's a lot that will come out of that. Again, it's not the sexiest sounding piece, a Technical Assistance Center, but it really will be so critical for making sure that this work gets done and gets done well across Illinois. And I wanted to build on too sort of what you were talking about with engaging community partners and how important that is. I think we should expand that conversation to include some non-traditional, or maybe at least non-traditional to these kinds of conversations, partners in the community as well. So in addition to those social service agencies or nonprofits, and in addition to schools, places like faith-based organizations, or we held a similar conversation at UIC earlier in the year before the legislation was passed. And one of our panelists at that conversation was a group called Hope for the Day. And they actually have a coffee shop where they post messages about mental health. And they're very active on social media, and they throw events. Yeah, go for it.
I follow them on social media, and I think every month they have a meeting specifically to address mental health, and they have different speakers come and talk. And I've never gone to one because I'm not from the city and that's where they're based. But I see like all the time they're like new event from Hope for the Day, and I look at it and see all the people that are coming to speak, and I'm like, oh, that's so cool.
Yeah, absolutely. And they actually held a youth forum back in September, I want to say it was. So I think groups like that, it's sort of places we don't expect these conversations to be happening. And that all goes a long way for helping to normalize mental health, right? For helping to bring this into the mainstream and really reducing stigma, which is such a barrier to why so many don't access services. And so I just wanted to sort of highlight and uplift that piece as well, is that there are partners even beyond campus in the community, beyond the traditional sort of nonprofit and social service partners like my group and Jen's group, which are doing wonderful work, but there are places where I think all of us have an opportunity to plug in and really be advocates and champions for mental health. Let us see. I guess we've talked quite a bit too about I didn't miss anyone, did I? That wanted to add to, okay. I saw a mic move out of my peripheral there. We've talked a lot about all of the wonderful pieces of this legislation and how exciting it's going to be when all of this gets up and going. Jen, help ground us here. Sort of what's the next step? Do we anticipate any challenges? Are there things that we all, as advocates for mental health, can do to help support and make sure that we realize all of the good things that we have envisioned together as part of this legislation?
Yeah, thank you so much for asking that, Amber. There's certainly a need here for advocacy. As Dr. Albert mentioned, in order for us to realize the full potential of this legislation, it needs to be fully funded and fully implemented. And therefore, we have to continue to make mental health a priority for our state government. The primary funder of the higher education institutions that are targeted in this legislation. We need to ensure that the resources are available to support public universities and community colleges to implement these provisions, right? Because it could be many of these things, again, are things that universities and campuses do right now. But formalizing that, filling the gaps, that's an opportunity for our state to really invest in what I think is a really prevention-oriented effort here. This is the time to target students. This is when we have a captive audience, right? We just need these pieces in place. So one action that you can take is to talk to Dr. Albert and some of our other partners at the state about about including the resources needed here in the next budget cycle. So the governor typically gives his budget address in February, and we'd really like to see the resources needed in his address. So that's the goal. Signing up on your sheets here with your email addresses would be a great way to be connected with some action alerts and advocacy alerts around this topic in particular. Young Invincibles, Thresholds, NAMI Chicago are really invested in our advocacy strategy around how to get this legislation funded. So we need the resources available. We need to work on the implementation timeline, which is something that we've kind of done as partners, but and then we need to come to the table with our university stakeholders to say what are we missing? What else might you need here that we haven't thought of, and how can we be supports as advocates to you? And that's really the role that I see us playing, right? These are resources that are needed on campus to fill some of the gaps, and we are of service to you to make sure that happens.
Excellent, thank you. And I think when we turn it over to Emily here shortly, I think she's gonna give us a call to action and tell you all a little bit more about ways that you can get involved with Young Invincibles. And of course, Jen or I are happy to talk to you about the work that we do in leading advocacy efforts around the state as well. So if that's something that you're interested in addition to being sort of ambassadors and taking this conversation with you today into all of the spaces that you're in, with your friends, with your family, with your networks online, if you're interested in taking sort of a more proactive role and want to get engaged in that way, certainly Young Invincibles does some great organizing work, and like Jen said, she and I are together on the Healthy Minds, Healthy Lives Coalition. We'd be happy to talk to. But before, we're about to transition to questions from the audience, but before we do that, I wanted to sort of create space for us to hear from Allison, because, sorry, at the risk of putting you on the spot, I'll talk for a minute so you can think about what you might want to share, but we're all here today for a conversation about campus mental health and how we can support young people both on campus but also in the community and building partnerships with community-based groups and faith groups and all of the other partners that we've talked about today. There are many of those folks represented here on our panel today and in our first panel. What would you like us to know, Allison? Sort of help point us in the right direction. What do you think would be most meaningful to you in terms of supports or how we do our work, either from a campus, you got the ear of the administrators here, or from the state and the resources and support that they have. Obviously, again, they play a critical role, and then there are many of us who represent sort of service providers and supports in the community too. So what do you think that we should know?
Well, two things. I was looking at the fact sheet this morning preparing, and I saw that well, I think that more support needs to be added because so much of the mental health is community and colleges are growing, and I think that more support, and also one of my, personally, I had difficulty on college campus getting support because of the number of times you're able to see the counselor. I was able to get support during the time I was having difficulty, but that had a lot of issues with getting support specifically on campus. I think that adding a greater number of times you're able to see the counselor to help get support would be a good help. Also, on the fact sheet I saw that you would be able to have telehelp, and I think that would be really important because I know that a lot of disabilities and mental health go hand in hand, and I think that having telehelp or like implementing Skype or something to create a way for students with disabilities that make it difficult for them to get to school, because I know that a lot of classes at COD are online for students who are either far away from the campus, but also it's really helpful for students with disabilities. And so I think that the telehelp is important to implement because it can help those who are unable to get to campus. So yeah.
Excellent, thank you. So I'm hearing telehealth and expanding access to services. So thank you so much for sharing that. It's really important for us to hear from folks like you about what you need, because that's what we're all here for, is to figure out how to make this work better for students. So we really appreciate you sharing your experience and sort of what you see as opportunities for us to do a little bit better. So with that, then I'm going to go ahead and open us up for questions from the audience, and I think we have about 10 minutes from that, and I believe we'll have folks circulating mics here. So I'm going to start with this lady here in the pink scarf.
I have one mic. So
oh, sorry, we have one mic and we've already handed it out. Yes, I recognize Merle.
I really appreciate that you passed this bill this year. The thing that I have a question about is my older daughter went to Northwestern, and last year they had 5 suicides. And so what I want to find out is the bill only applies to state schools and not to, like, Northwestern. My other daughter goes to Loyola, so they don't apply to them. And I want to know if you guys are going to try and pass a bill to apply to those schools as well as to the state schools.
Yeah, thank you for raising that. I think you're absolutely right. These issues are not unique to students on any one campus or students who attend public universities or community colleges. This is something that impacts young people across the country, no matter what sort of institution they're enrolled in. So certainly there is a need. And I'm going to let Jen speak to a little bit more of the strategy around why we started with public universities and community colleges and sort of what the vision is moving forward to expand access.
Yeah, Amber is absolutely correct that the vision here is that these supports are available to any young person on any campus in any part of the state, right? But there was a bit of a strategic approach to taking one step, particularly among the state universities and college campuses that are where the General Assembly has some oversight, right? So that was the initial approach to sort of build this out, to take some time to see how implementation goes, and absolutely within our long-term legislative plan to apply these provisions or any sort of modified provisions that we see through the implementation here to public universities. That's certainly part of our advocacy strategy.
Excellent. So I'm hearing that this is sort of a foot in the door for us to get the ball rolling, and that we certainly hope that this is something we can work with the private institutions as well on.
Absolutely.
Wonderful. Great. Yes, ma'am.
Hi, my name's Andrea Politis. I'm in the Human Services Program. I'm curious if the legislation provides for funding for these technical assistance centers, or does that have to come out of the college budget?
So the funding, this program overall should be funded generally through a separate stream. And the Technical Assistance Center, I believe that we put in a percentage of the funding for the overall program needs to go to the Technical Assistance Center so that it would be baked into the Illinois Higher Ed Board budget. That's the intention, because it'll sit within the Higher Ed Board.
Okay, and are there also provisions to help train faculty on working with students that have mental health issues?
Yes, within the training section of the legislation, there are provisions for training for faculty and staff, and with some particular adults on campus targeted, like campus security and academic counselors, but yes, certainly provisions for training staff.
Wonderful, thank you. Yes, ma'am.
Hi, Dana Thompson. I'm in the Counseling Center here at College of DuPage. And in terms of the legislation, what would you see as what would implementation look like, and what would you say would be our next steps?
That's a great question. I would really encourage particular institutions to look at their current programming and look at it against the sort of rubric that we developed within the legislation. So where are you already doing awareness building for faculty and staff, like right here, right? And then what could building on that look like? So, and this may be a tool that we can sort of share as advocates to institutions, but kind of using the legislation as a matrix of where are we meeting some of these provisions now, and where could we use some additional support. And I think that that would be a great first step, because we know that some of this is happening, a lot of this is happening in a lot of different places. And I would also encourage institutions to talk to their legislative affairs or government affairs folks, because right now is the time to be putting in requests for funding. There's a provision within the legislation that requires the Commission on Government Forecast and Accountability, Amber, is that right, CAGFA? Yes. To sort of look at what it would cost for the state to implement this legislation overall, and that's really being driven by what campuses need to do this work. And I have been told that there is a survey out right now asking for what institutions would need. So I would really encourage talking to your government affairs folks and really asking for what you need.
So I'll just jump in from the COD perspective, because all the COD people are like, what are you all doing? So we did get a copy of the survey. The survey is due on Friday. And it does break down really nicely all of the areas in terms of what the provisions are and where we are. So you sort of rank them on a, we're completely there, or there's a lot more work to do. And then there is room for, and how much money do you think it would take to get there, kind of thing. So we have been very intentionally looking at that survey. And it also has been an eye-opener too, to sort of take a look at where is it that we need probably the most funds as well.
Yes.
One thing I would encourage, and I suspect you're already there, is that you have an intentional planning process for how are we going to address this legislation and what partnerships do we need. And I know that the Federation would be happy to be involved in that planning process. One thing that sometimes I look at is, what existing resources do we have that we can use? What are out there that we haven't yet tapped, but maybe we could? And then where do we need new resources? Because one of the things that will kill a new effort like this real quickly is pie in the, and I know I'm not at all accusing you of doing this, but there have been other people that in the past have thought the solution to all their problems is more money, more money. And I can promise that's not the solution. The solution, 80% of the solution is better use of existing resources, and then maybe there's some new money too that's needed. And the nice thing about DuPage County is we've got lots of practice at doing it. So.
Excellent. Yes, ma'am.
Hello, I have a question. It's in regards to the 1250 ratio. So it states here, I have an overall summary of the legislation, and it says here to benchmark a ratio of 1 clinical non-student staff member for every 1,250 students. So can you tell me, what does that mean exactly?
Sure, I'd be happy to. So within this section of the legislation around building capacity, of which, that's just one part of what the vision is here, we wanted to include some measures that would allow us to do some evaluation about growing capacity on campus. So we looked at some national numbers around the ratio of clinician, like a counselor, within the the counseling center here.
So, like myself, for example.
Like yourself,
okay,
exactly.
So an employee.
An employee. That's and in some cases, graduate level students are used within counseling centers and other spaces. So we included in this provision that it really had to just be staff, and that. So we looked at ratios nationally around student to staff clinical student to clinical staff, and what the aspirational numbers are for one student to clinical, or a certain number of students to clinical staff. And we came up with 1250, which was kind of middle ground of what the aspirational numbers are. I think it was the International Association of Counseling Centers is aspiring to 1 to 1,000, right? 1 clinical staff to 1,000 students. So we put in a benchmark. It's not a mandatory ratio within the legislation. It's really a way so that we can sort of see how we're trending. And we actually don't know, there weren't public numbers on the current status on campuses across Illinois. So I couldn't really tell you at College of DuPage what the ratio looks like now. So what we sort of settled on was, let's figure out what the baseline is. Let's try to drive this to a space where there's enough clinical capacity for students and kind of watch the trend. So that's the reason it was there.
So my colleagues and I were wondering, are you speaking of like ratio to us, college counselors, to the student, or is that for all of us, like the college counselors, local service providers? Like, who in particular are we speaking of with the ratio of the clinician to the student?
Yes.
On campus, outside of campus?
That's
both.
great. That ratio includes anyone who students have access to. So part of the building capacity vision within the legislation is to expand that community-based capacity, those linkage agreements with Metropolitan Family Services, for example, or through telehealth. The legislation allows the campus or institution to count that clinical capacity towards their ratio.
And one last question too. So it does speak for us to have agreements with local service providers.
Yep.
So now for us moving forward, should we draft like official agreement documents to have, let's say like Grand Prairie Service is equivalent to like Metropolitan Services where I'm at. So should we draft a formal letter and have a representative from Grand Prairie to sign it? And that's our official agreement?
Yeah, so I'm happy to talk about some of the individual pieces offline. I would encourage you checking in with your administrative staff around this as well, and with the Board of Higher Ed, who will house the technical assistants. But I will tell you that the intention of the legislation was to have those formal agreements with community providers, partly so that we can sort of track the capacity, partly so that we know that those are really solid agreements, and that was really the vision of the legislation, or why it's the provision there.
last question. Oh, I didn't read that. What exactly is a technical assistance center? I heard you all say that.
So it is, it doesn't have to be a brick and mortar location, but what's envisioned here is that there will be staff in the Illinois Board of Higher Ed that is either within the board or contracted by the board that helps to support colleges and universities in setting up these provisions. So it can look like a contract with a provider, not a provider in our sense, but someone who would do these services. It could be a university within itself, but it's really some capacity to support questions really similar to what you're asking right now. What would we envision this looking like? What changes do we need to make? And how do we support campuses in getting up to capacity?
And that could be a place to help support institutions in developing, their policies on campus around mental health. It could be developing a template agreement that you all could work from. So those are just some examples of what a technical assistance center could do to help support the implementation. It's really there to be a resource and a learning community for all of the colleges and universities that are going to be embarking on this work. And I think we are a few minutes over time now, according to my wonderful timekeeper.
He had one question.
Oh, okay. Host privilege.
It's sort of a question/comment. Just to provide a little bit of context to the last question, there's some concerns among community college counselors specifically, which is a little bit different. Our roles are a little bit different from the counselors or the psychologists that are from the universities, right? Because traditionally the universities and the counseling centers, they are considered clinicians. They're usually staff psychologists, they're licensed mental health providers. At the community college, we're really not clinical. We don't see our role as clinical. The service that we provide is really not considered clinical. So the way that the bill was written, the way that the law is written is that it says clinical. And so a lot of us who work in community colleges, we're like, do we have to be licensed? What does that mean for us? Do we actually meet the ratio? So it's there's causing a little bit of anxiety and some concerns. So there were a lot of questions, I think, floating around amongst our group. And so
thank you so much for sharing, and I would be really open to a conversation about that and any sort of cleanup we might need to do as a result.
Excellent. Well, I want to thank you for being so engaged and for sticking with us and for all of your great questions. And I want to invite you to join me in giving a hand to our panel. Thank you so much. And with that, I'm going to go ahead and turn it over to our final speaker, Emily, who is a former College of DuPage student. And she's going to share a little bit about her experience and give us a call to action. So help me in please welcoming Emily.
My name is Emily Sen, and I want to thank you again for being here today. You've heard the tremendous challenge and opportunity before us, and we all need to come together to create a culture of support across campus where you and I study, work, and worship and succeed. You can contribute to making COD a community that promotes mental health, and meaningful change can happen even through small steps that you and I can take, such as through the different steps that Connor explained on that pledge sheet. Personally, when I was having depressive and manic episodes in my freshman year, it meant so much that I had classmates who were willing to just be with me and listen without judgment. It was important for me to have that peer support. For example, they were willing to drive me to Nami's living room to help de-escalate the suicidal ideation I was experiencing. And other friends helped me by sharing their own experience with mental illness, just putting down the barriers and being vulnerable about what they're experiencing. And they encouraged me that I could keep going, and more importantly, that there are professionals and people here who can help me so I don't have to endure hardships on my own. So students, you and I can continue to foster this kind of community of acceptance and support. And I also could not have finished my undergraduate experience without having understanding professors, faculty, and staff who are willing to work with me to extend deadlines or have access to studio hours, changing lab hours during mental health emergencies. And I hope faculty and staff at COD continue to grow in the knowledge of mental health so they can continue to support students here in a holistic way. All of us can individually enact change as we grow as a community at COD. Still advocating for mental health awareness needs to spread to our community in Chicagoland and extend into Illinois. And that is why our work does not end here. We call on our state legislators to continue to prioritize mental health and fully support funding for the Mental Health Action on Campus Act. We also encourage providers to collaborate with colleges and universities to fully implement the law so students are able to access the mental health support they need and deserve. While the challenge is steep, we can make a huge step forward if we all come together and do our part. So let's take the pledge on how we will advance change, take action tomorrow, and continue to learn together over the upcoming weeks, months, and years. Thank you for attending, and have a nice day.